My name is Quinn and I'm 10 years old.
Well, my pregnancy with Quinn was fairly uneventful. We had planned for natural childbirth with her as we had with our firstborn, our son. At about 34 weeks, I was experiencing some abdominal pain and was told that my daughter would have to be delivered via C-section. So obviously very scary and traumatic for us. 48 hours after she was born was when she first presented with sort of an unusual rash that covered her body from head to toe. The neonatologist had just told us that she'd never seen anything like this before. So she was actually discharged without a diagnosis. The pediatrician just started referring us to different specialists, one after another. So from dermatology to immunology, oncology, neurology, specialist after specialist. Week after week, it was just worse. She was not really gaining weight. She was failing to thrive, and I could just see that she was suffering.
For the first 6 months to a year of her life, we were wondering if she'd survive. She had gotten to a point where we thought she may not.
Not knowing is the worst part. We make it to, the week of her first birthday. She fell terribly ill, and it was during that hospitalization. She was in PICU. Her pediatric rheumatologist first came to us with a possible diagnosis of NOMID. And Quinn was given her first injection, and we were just so delighted by the results, and just so glad that some of those symptoms that had been coming and going over the course of that first year of her life were starting to resolve.
When they actually discharged her from the hospital, all I could think about is I could not believe that I had my little girl in the car with me on our way home. And it was wonderful.
We were told to look for injection site reactions. That happened very early on when she started injections, but they sort of vanished after that.
I like to go to ballet class on Tuesdays, but if it's not Tuesday, then I ride my bike and play with my brothers and my friends.
Quinn has been on Kineret for as long as she can remember now. As a little one, it was much more challenging. Injections are never fun. But there's a light at the end of the tunnel, because as your child grows, their understanding of the medication, the treatment, and the importance of it comes. So, her injections are just part of her daily routine.
Every day I do my injection, and this is a chart that helps me remember what spot I do each day. Like on Sunday, I'm gonna do my left arm, and then on Monday, I'll do my right arm.
It feels nice for her to have a little bit of control with her shots.
I sometimes think back of the times where she was just such a sick child, and it just puts me in a place where I can't believe how well she's doing. The Kineret On Track program has been very helpful to us. The people are wonderful. They have case managers and nurses available. When it's time for a refill, they'll contact me every month. The medication usually arrives the next day. Very well packaged, plenty of ice. We get it in the house, unpack it, and get it in the refrigerator.
Quinn's always been my bright little shining star. She is a special girl.
Indications. Kineret anakinra is a prescription medicine called an interleukin-1 receptor antagonist IL-1RA, used to RA. Reduce the signs and symptoms and slow the damage of moderate to severe active rheumatoid arthritis RA in people aged 18 years and older when one or more other drugs for RA have not worked. NOMID. Treat people with a form of Cryopyrin-Associated Periodic Syndromes CAPS, called Neonatal-Onset Multisystem Inflammatory Disease, NOMID. DIRA. Treat people with deficiency of interleukin-1 receptor antagonist, DIRA. Kineret is not for children with juvenile rheumatoid arthritis. Important safety information. Do not take Kineret if you are allergic to proteins made from bacteria called E. coli. Ask your healthcare provider if you are not sure. anakinra, or any of the ingredients in Kineret. See the end of the patient leaflet for a complete list of ingredients in Kineret. Before starting Kineret, tell your healthcare provider if you have an infection, a history of infections that keep coming back, or other problems that can increase your risk of infections. Are scheduled to receive any vaccines. People using Kineret should not receive live vaccines. Have kidney problems. Are pregnant or plan to become pregnant. It is not known if Kineret will harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if Kineret passes into your breast milk. You and your healthcare provider should decide if you will use Kineret or breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Kineret and other medicines may affect each other and cause serious side effects. Kineret may cause serious side effects, including serious infections. Kineret may lower your ability to fight infections. Call your healthcare provider right away if you get an infection, have any sign of an infection including a fever or chills, or have any open sores on your body. Due to the risk of infection, you should not receive live vaccines while you use Kineret. Serious allergic reactions. Stop using Kineret. Call your healthcare provider and get emergency help right away if you have any of these symptoms of a serious allergic reaction: swelling of your face, lips, mouth, or tongue, trouble breathing, wheezing, severe itching, skin rash, redness, or swelling outside of the injection site area, dizziness or fainting, fast heartbeat or pounding in your chest, tachycardia or sweating. People with DIRA may have an increased risk of allergic reactions, especially in the first several weeks. Decreased ability of your body to fight infections, immunosuppression. It is not known if treatment with medicines that cause immunosuppression, like Kineret, affect your risk of getting cancer. Amyloidosis. Kineret may cause a buildup of abnormal proteins called amyloids around the injection site, a hard lump under the skin. Avoid using the same site to inject Kineret by rotating to alternating areas of the body. Your doctor may monitor you for amyloidosis. Low white blood cell count, neutropenia. Kineret may cause you to have a lower number of certain white blood cells, neutrophils. Neutrophils are important in fighting infections. Your doctor should do blood tests to check your white blood cell level before starting and during the first year of treatment with Kineret. The most common side effects of Kineret include injection site skin reactions. The symptoms of injection site skin reactions may include redness, swelling, bruising, itching, and stinging. RA gets worse with treatment if you already have RA, headache, nausea and vomiting, diarrhea, joint pain, fever, feeling like you have the flu, sore throat or runny nose, sinus infection, pain in your stomach area. Tell your healthcare provider if you have any side effect that bothers you or does not go away. These are not all of the possible side effects of Kineret. For more information, ask your healthcare provider or pharmacist. You can also see the full prescribing information for Kineret, including patient information and instructions for use at https://www.kineretrx.com/pdf/full-prescribing-information-english.pdf. To report suspected side effects, contact SOBI North America at 1-866-773-5274 or FDA at 1-800-FDA-1088.